Hey there! If you've ever experienced a sharp, stabbing pain in your heel when you take your first steps in the morning, you might be dealing with plantar fasciitis. This condition affects nearly 2 million Americans each year and can turn simple activities like walking into painful ordeals. So what exactly is plantar fasciitis? It's inflammation of the plantar fascia, a thick band of tissue that connects your heel bone to your toes and supports your arch. Think of your plantar fascia as a bowstring. When tension becomes too great, it creates small tears in the tissue, leading to inflammation and pain. But why does this happen to some people and not others? Research published in the Journal of Research in Medical Sciences identifies several risk factors. Certain physical activities put excessive strain on your heels. Runners, dancers, and those who stand for long periods are particularly vulnerable. Weight also plays a significant role. A study in the Journal of Bone and Joint Surgery found that individuals with higher BMI are 2.9 times more likely to develop this condition. Age is another factor, with plantar fasciitis being most common between 40 and 60 years. As we age, our fascia loses elasticity and becomes more prone to injury. So where exactly does plantar fasciitis hurt? The pain typically centers at the bottom of your heel, sometimes extending into your arch. Many people describe it as feeling like a bruise or ache deep within the bottom of the foot. For some, it's a sharp, knife-like pain. The pain is usually worst with the first steps in the morning or after long periods of rest. It often improves with activity, but worsens after extended periods of standing or exercise. Now, how can you tell if what you're experiencing is definitely plantar fasciitis? A 2018 study in the American Family Physician Journal reports that 80% of cases can be diagnosed based on history and physical examination alone. The hallmark sign is that first step pain after rest. If your foot hurts most when you first get out of bed, plantar fasciitis is a likely culprit. So what can you do about it? Let me walk you through a step-by-step approach to finding relief based on recommendations from the American College of Foot and Ankle Surgeons. Step 1. Rest and reduce activities that cause pain. This doesn't mean becoming sedentary, but rather avoiding high-impact exercises temporarily. Step 2. Ice your heel for 15, 20 minutes, 3 to 4 times daily, especially after activity. A frozen water bottle rolled under your foot can provide both ice and a gentle massage. Step 3. Stretch your plantar fascia and calf muscles regularly. A systematic review in the Journal of Foot and Ankle Research found that stretching protocols significantly reduced pain in 73% of patients. Let's do a quick stretch right now. Sit down and cross your affected foot over your knee. Grab your toes and gently pull them toward your shin until you feel a stretch along your arch. Hold for 30 seconds and repeat 3 times. Doing this first thing in the morning, before taking those painful first steps, can make a world of difference. Step 4. Invest in proper footwear. A 2018 study in the Journal of Orthopedic and Sports Physical Therapy found that shoes with proper arch support reduce symptoms in 68% of patients within 12 weeks. Step 5. Consider over-the-counter arch supports or custom orthotics. These devices help distribute pressure more evenly across your foot. Step 6. Try nonsteroidal anti-inflammatory drugs like ibuprofen to help manage pain and inflammation in the short term. For most people, these conservative treatments resolve symptoms within 6 to 12 months. In fact, a study in the British Journal of Sports Medicine found that 90% of cases resolve with these approaches alone. But what if your pain persists? More intensive treatments might include physical therapy, which can teach you specialized exercises and techniques. Research shows that targeted PT can reduce pain by up to 60% within 4 weeks. Night splints that keep your foot in a dorsiflex position overnight, preventing the fascia from tightening while you sleep. Corticosteroid injections for short-term relief, though these should be limited as repeated injections can weaken the fascia. Extracorporeal shockwave therapy, which uses sound waves to stimulate healing. A 2018 meta-analysis in the Journal of Pain Research found this treatment effective for chronic cases. In rare cases, surgery might be considered, but only after at least 6 to 12 months of conservative treatments have failed. The good news is that you can take steps to prevent plantar fasciitis from developing or returning. Maintaining a healthy weight reduces pressure on your feet. Regular stretching of your calves and feet keeps your fascia flexible. A study in the Clinical Journal of Sport Medicine showed that a daily 5-minute stretching routine reduced recurrence by 65%. Gradual progression in exercise intensity helps too. Many cases develop when people suddenly increase their activity levels without proper conditioning. And remember to replace worn-out shoes regularly. Athletic shoes typically lose their cushioning after 300 to 500 miles of use. Living with plantar fasciitis can be challenging, but with patience and consistent care, most people make a full recovery and return to their favorite activities pain-free. If you found this information helpful, please give this video a thumbs up, share it with someone who might be suffering from foot pain, and subscribe to our channel for more evidence-based health content. Have you dealt with plantar fasciitis before? Share your experience or questions in the comments below. Thanks for watching, and here's to happy, healthy feet.